views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening and welcome to BronxTalk. With the controversy raging over whether or not to open schools or how to open schools, the whole concept is based on young people's health. And we're thinking about their physical health, certainly. We're thinking about their academic health, and to some degree thinking about their emotional health. But there's a whole other level of health that pertains to young people in the Bronx and certainly many other places, maybe specifically in urban places. And that's of great concern. And maybe that's why in the middle of all of this very difficult intensity over what to do with young people, how to keep them occupied, that the New York City Department of Health and Mental Hygiene's Teen Connection Youth Program received millions of dollars in a grant to continue the great work that they've done in helping to address some of the issues about romance, relationships, sexual health, and all these things, and certainly dealing with teen pregnancy, which historically has been a big issue in the Bronx. Enter the next step, and the next step comes from NYU and a project called Project Yes, which is doing a study of our young people and about their mental health, their sexual health, their relationship health, and really kind of delve into the next step. And that's what we're going to talk about this evening. So let's start with welcoming Estelle Raboni, who's the acting assistant commissioner of the Bureau of Maternal, Infant, and Reproductive Health at New York City's Department of Health and Mental Hygiene. Nice to have you back in the program, Ms. Raboni.
Thank you so much, Gary. Nice to be here.
And she brought with her Danielle Murray, who is a New Visions High School for the Humanities graduate, a member of the Honor Society, which we tremendously respect. She'll be attending Simmons University in the fall. She is a graduate, or maybe even still a member of the New York City Teens Connection Youth Leadership Team. So nice to see you, Ms. Murray.
Thank you. Nice to see you too.
And then let's go down over to NYU and our friends at NYU and Dr. Yzette Lanier, the assistant professor at NYU in the Rory Meyers College of Nursing, who is running the aforementioned Project Yes. Nice to have you with us, Dr. Lanier.
It's nice to be here. Thank you for having me.
Ms. Raboni, let's start with you. You and I have had this dialogue on Bronx Talk before. The Teen Connections program has had remarkable success in the Bronx. Why don't you just bring all our viewers up to date as to what, how that happened, what the program is about, and then, of course, we'll start talking about where we are right now, which is a very difficult time. Go ahead.
Absolutely. So the New York City Teens Connection program is part of the New York City Department of Health. It focuses on creating an environment for young people that supports them in their decision making. So we work with nearly 200 high schools and soon to be middle schools, colleges, youth serving organizations, foster care agencies, and we build capacity in those environments to be able to implement evidence-based sex education. That means education that actually has been proven to be effective with young people in either delaying sexual activity or helping them to make better choices when they do become sexually active. And then all of the young people that we work with through these partners are actually partnered with a high quality teen friendly clinic. So every young person actually gets their own health home that they can go to when they want to follow up with, you know, meetings or doctor visits or contraception or whatever the case may be. Historically, we started in 2010 in the South Bronx under Bronx Teens Connection, and we focused on community districts 2 and 3 of the South Bronx. Over that 5-year period, we reached about 7,000 young people. Then in 2015, we received a federal grant to expand even further into New York City. And in our 4-year period, we reached a little over 40,000 young people. And now with this increased federal funding, we hope to be reaching 30,000 people every year.
And can you just define for me, I hate to use the word when we're talking with the people from the Department of Health, the germ of concept that really worked well, and why did I mean, the partnerships I get, the work in the schools I get, but you know, there's a lot of people doing a lot of things with kids and a lot of things in the schools that don't quite work out as well as this, addressing a very difficult issue. Why did it work? What's the germ? What made it work?
I mean, I think it really is, it is about partnerships, and it's about providing content and services that young people really need. I mean, part of that, and one of the reasons I'm really glad that Danielle is with us, is that we don't create anything for young people without young people having input into it, right? So I'm a middle-aged woman. What I say in terms of what young people do or need is irrelevant. It's really about providing voice to young people. And I would say that the partnerships have been really strong. So we work very closely with DOE. We work very closely with our nearly 300 partners across the city. And even in a time of pandemic, so for instance, on any given year, we reach about 15,000 young people. And once the pandemic hit, we thought, okay, well, teachers are not going to be implementing sex education at this time. Clinics are not going to be seeing young people. But we were actually pleasantly surprised because teachers were reaching us and saying to us, how can you help me? How can you support me provide this virtually? And how can we continue to serve the young people, particularly in this very vulnerable time? So that was amazing. And as I said, normally we reach 15,000 young people. This past year, we reached slightly more than 10,000 young people in this past
and this
year.
is exactly why I introduced it like that. So this is the kind of thing that flies under the radar, but the schools recognized in their young people, this is what they've got to do. It wouldn't be me if I didn't dig a little deeper, and that's why we have Danielle Murray with us. Ms. Murray, talk to me about why you got started with the Teens Connection program, how you got started, and then ultimately what did it help you do, and why are you still a member of the program even as you move on and go to college?
So I got started with the YLT because of my mom. When I was younger, she used to teach me a lot about sexual health so I could be educated before I was ever experienced. And I wanted to join the YLT because growing up in the Bronx, it's hard for teens to talk to adults. And a lot of teens are misguided when it comes to the topic of sexual health. So I wanted to be a support system to teens so they could talk to me or talk to other teens about sexual education.
You were very fortunate in that case because number one, you had a mom who sounds like she was enlightened and understood how to deal with it, and she worked to educate her daughter about it. I'm sure that you see in many of your friends and colleagues and others, they are not quite as fortunate. What kinds of things have you been able to share with them that you think really help guide them and keep them safe and keep them healthy? And certainly, listen, you're not, just say no, boy. Good luck with that,
Some things I have been able to help my friends with is like explaining to them what a healthy relationship is and explaining to them where they can go and get birth control and how to properly use a condom. Because a lot of teens don't they learn that in school, but a lot of teens, when you're in school, we don't pay attention or we get distracted. We get distracted by our friends. So
listen, I'm going to tell you, I went to high school a lot longer ago than you did. And we had sex education classes. And other than the giggling in the back of the room, I don't even know what I got out of it. But this seems to me, the perfect introduction to bring Dr. Lanier in and Project Yes. So Dr. Lanier, let's talk about what is Project Yes. And I know that this just feeds right into what you and your colleagues at NYU were working on.
Yes, absolutely. So Project Yes, which stands for Youth Engaging in Healthy and Safe Sex, is a research study funded by the Centers for Disease Control and Prevention. And the main goal or objective of the study is really to understand how young people, particularly Black and Latino adolescents and young adults, make different decisions about their sexual health in the context of their romantic relationships. Of particular interest in this study is the focus on use of HIV prevention methods. So those would be male-female condoms, HIV and STI testing, and pre-exposure prophylaxis, or PrEP. And for those who may not be familiar with what PrEP is a daily HIV medication for individuals who are currently HIV negative, but who may be at high risk for acquiring HIV.
Talk about, oh, I'm sorry, talk about epidemics in the Bronx and pandemics. We've gone through the HIV thing, and I think there's a lot of people who would say, oh, well, you know, that we're done. We don't have a vaccine, but we're done with that. Just before you go on, just talk a little bit about HIV and where we're at right now and why NYU thinks it's still an issue that needs to be addressed directly.
Yeah, so HIV is definitely still an issue. So if you look nationally, about 21% of new HIV infections are among youth ages 16 to 24. When you look at youth, what we find is that all youth aren't equally represented. So you see that there's these racial and ethnic disparities where Black and Latino youth are the ones who have the higher rates or who have the higher incidence of HIV. When you look at New York City, the Bronx is one of those boroughs that has high rates of HIV and STIs. And so that's really a main reason why it's still a prevalent issue.
What and as you do the study, first of all, I do want to mention, and we'll put up all the information about, you know, people who want to participate.
Yeah.
What do you hope? And I know you don't know what the results will be. You don't want to prejudge the results, but what are the kinds of things you'd like to hear from young people? And they will be paid if they participate in the study. This is like a real thing. This is not like, hey, we're just going to kind of, you know, do check boxes. This is a real thing. So tell me, what is it that you're really looking to hear from them and learn from them?
Yeah, so I can tell you that, as well as we do have some preliminary findings that I would love to share with you. So first, we're really trying to better understand young people's romantic relationships. And so when I say that, we're really looking to get a better sense of the makeup or the dynamics of young people's relationships. The second piece is really understanding the factors that may facilitate or hinder young people from using different HIV prevention methods. And what we found is that relationships can be a barrier to using HIV prevention methods or a facilitator.
You know, I mentioned just a moment ago about, you know, my own, you know, time as a youngster, and Ms. Raboni mentioned her time, and we're well aware that it's not about us, and I know, Dr. Lanier, you probably feel similar. So I'm going to ask Ms. Murray about this climate these days. Number one, with the pandemic and the fact that, you know, we all have pent up energy. I can't even imagine what a middle school youngster has inside them and what they're feeling, and or a high school student. So number one, let's talk about how this might affect young people in the Bronx right now. And then the second part is access to digital technology and cell phones, which open up everything. I don't even want to suggest what I'm referring to. So first, Ms. Murray, let's just talk about you and your friends and how you've been doing in this regard during this lockdown and difficult time.
This pandemic has been very stressful for me and my friends. I've stated that it made us closer, but it also like showed like our differences. Because it's like when you're locked in the house for so long, you really don't know like what to do. After you do the same thing over and over, or the same days, you get like really bored, and you try to like.
That goes for everybody. Don't I know it? But go ahead. I'm sorry.
You try to find something new, like a new outlet, like try something new or like learn something new to like keep yourself entertained.
Very logically, you're looking for something new, and you're sitting there, and you've got your cell phone in your hand. Mm-hmm. And that, again, as I said, opens up the whole world. Has the advent of the cell phone, the proliferation of the cell phone, the fact that just about every young person is holding one, has that complicated some of the issues and challenges that young people face in trying to make the right decisions?
Yes, I would say yes, and I would say no, because young people look up to a lot of people on social media. Like we follow a lot of young celebrities and stuff, so that does dictate our choices.
Right.
but I also say no because I feel like a lot of us young people, we have our own minds and we make our choices based off our environment. Like we go off social media, but we base most of our choices off of, like, our environment and how it would affect us.
You know, I really appreciate that, because it's very easy to follow the suggestion that I made that, oh, wow, you know, it's like it's this crazy tool that you can do anything with. And your reaction is, hey, give us a little credit, right? Like we have young people who are thinking things. I think that's an education for all of us older folks. Ms. Raboni, we're going to show a video now. You have this video that you did, which really addresses these kinds of things. You want to introduce it at all, or let's just let it roll?
Absolutely. I just want to provide a little bit of background. So as I had mentioned before, we don't do anything for youth without youth. And so the youth were really instrumental in the production of this video, but also in the content of the videos. They worked on what's called a youth participatory action research program. So they actually collected data. They conducted focus groups of other young people. And then they collected all of the themes that were mentioned in those focus groups and participated in the film production and the storyboarding of the videos. So there are actually 3 videos. The social media campaign was called Ask Before You Act. The idea was that they wanted to focus on sexual consent, and not just in terms of, you know, can I engage in sexual activity with you, but can I kiss you? Can I touch you? There were, you know, to Dr. Lanier's point, there were a lot of questions about, you know, if we're in a relationship, how much availability to you do I have? And so this particular video focuses on the kind of miscommunication that sometimes is conveyed when you're texting each other as opposed to talking to each other face to face. And it features 2 of our youth leaders.
Let's roll the video, and then we're going to get Dr. Lanier's input on the things that she's heard just now, because it just feeds right into what they're doing over there at NYU. So let's take a look. Well, there you go. Lays it right out on the line. Dr. Lanier, talk to me about what you've heard when you hear Ms. Murray talk and what you hear the City of New York working on. Talk to me about how this interfaces with Project Yes. I mean, it seems to me it's like, wow, we're really on the same page here.
Yeah, in so many different ways. So it's all about sexual decision making, and I think really helping youth to make informed decisions about their sexual health. I really love that the program focuses on consent, sexual consent, and consent in different ways, so kissing and sex, because that's something that we often is overlooked. Even thinking about moving forward in my own research, thinking about something about like sexual readiness. So helping young people even think about whether they're ready to engage in sex before they have this conversation with their partners about moving to the next level.
You know, I want to just refer back to what we heard from Ms. Murray. She was very fortunate because she had a mom who understood these things, and a lot of moms, sometimes even for religious reasons and other reasons, don't feel comfortable about talking about it. Is there, and I'm not only talking about moms, I mean, I'm a guy, and so fathers also need to have a role. You want to just address what role they might have, Dr. Lanier, in this? And I think we got a real good role model example there, but just your thoughts about that. It's not only the teens, and maybe they shouldn't quite feel that alone. So talk about that a little bit, if you would.
Yeah, these are conversations that a lot of people are uncomfortable having. parents are uncomfortable having, clinicians are uncomfortable having, teachers are uncomfortable having these conversations. But really, these conversations should be happening, I believe, in a number of different settings so we can normalize the conversations. I have a colleague who does research looking at families and how parents' roles in talking to their youth about sex. And what he's finding in his research is part of it is training, helping parents as well as youth just becoming comfortable having these conversations.
This
That's the first step.
This seems to be cyclical because it goes right into what Ms. Raboni talked about in terms of a variety of partners. So they'll talk about it in school, and then they'll talk about it maybe you know, with their colleagues or friends, or they'll talk about it in other places. It starts to normalize the conversation and makes it less like, you know, I don't want to talk about this, or goodness gracious, don't let me, you know, that kind of thing. Ms. Raboni, tell me about your point of view. I'm sure you guys are all on the same page here.
Yes, I mean, to Dr. Lanier's point, a couple of years ago, the health department had actually conducted a survey of Bronx adults, of Bronx parents, and we wanted to learn more about, you know, are you providing, you know, sex education or having the talk with your young person? And the findings that we had was that, first of all, they felt really uncomfortable having those conversations because no one had had the conversation with them. So they didn't have any frame of reference to use to have those conversations with their young people. And two, they actually assumed that those conversations were already happening, that those conversations were being provided in school, and it kind of gave them an out, so to speak, that, you know what, it's being taken care of. Somebody else is having the conversation. I'm too uncomfortable. I've never had this conversation. I don't know what kind of information to share. And so that's why parent engagement is actually a really big part of this new phase of our work, where we're going to be working with parents to help them build that confidence.
Ms. Murray, in your mind, do you have friends that, or others who participate in the program that you believe you really affected them and you really helped change their life in some way or had good effect? I mean, I know you put out a lot of stuff, but do you ever see it back and say, wow, that actually worked. I actually did some good there.
Yes, I've helped some of my friends with their relationships or with like ways to go get birth control and different things like that, that has impacted their life to help them make better decisions so they can prevent pregnancy and don't get an STD.
One of the aspects of this, and I mentioned it right at the top, is that it is actually a Connections Youth Leadership Team. This must give you, I'm just talking about you and your growth, to be a leader, that you feel like you can share something. And it's probably helped you. I'm sure it's going to help empower you as you begin college as well.
Yeah, I feel like the YLT had made me a leader, but it's also made me a more open-minded person. It made me a better listener, to hear others out before you judge them. Like, it shows you that everybody's story is different and you can't judge a book by its cover.
You know, there are, you know, I always do the check boxes. There's a million check boxes in this program, and I'm always concerned about young people in the Bronx because sometimes we let them out on their own and with nothing. And here, boy, we're hitting a lot of boxes. All right, let's start to wrap it up. Ms. Raboni, so what's next for your program? How are you going to use this fortuitous grant? Congratulations again. In this day and age, who can imagine? But how are you going to use it? And then also let's put out a little contact info for anybody watching. And that would involve educators, parents, health officials, others who are interested. This is NYC DOH. That's who you want to talk to. So go ahead, tell me where we're at, and then let's do the contact info.
So we're really going to be saturating the communities where we started this work. So we're expanding to more high schools. We're actually, for the first time, expanding into middle schools because we know that about 13% of ninth graders are already sexually active when they enter high school. So clearly, if we're just starting to talk to them in 9th or 10th grade, we're already too late. So we want to be able to reach young people earlier. So expanding into middle schools, the parent engagement piece, so being able to really work with parents is significant. And just expanding more into the Bronx, more into North and Central Brooklyn and other areas of the city.
Great. Dr. Lanier, I guess the same sort of question for you. How can people participate in this? What's the timing of it? Like, are we now, or are you going to start it soon? And how many people are you looking for? And if you want to do some of the particulars, because there is payment. I mean, there's real incentive here. And that, of course, is part of the grant process. But why don't you fill us in about Project Yes and how young people can participate?
Yeah, so we are still recruiting for Project Yes now. And so if you are interested in finding out more information about Project Yes or interested in participating, you can go to our Instagram page, which is Project Yes NYC, and that's yes with 2 S's. We are, still in motion, and our ultimate goal is to get this information. I love what Ms. Raboni said earlier about involving the voices of youth, and that's really the purpose of the study, to take this information, have young people participate, take this information, and to develop a program for young people around building healthy relationships, as well as increasing their use of HIV prevention methods. I love how you mentioned participant incentives, because we do want to pay participants because they are providing us with really important information, and we respect that, as well as we understand that their time is valuable. They can be doing a number of different things. So
right. So and there is a Metro card apparently available, and as well as
other incentives.
I got the numbers here. Can I say what the numbers are? So you can earn up to $75 for participating. You receive $20 for completing the first survey, $25 for the second survey, and $30 for the third survey. This is real incentive. Young people, especially who've been denied the opportunity for summer youth employment, just by being real, you could make a couple of dollars, what the heck, and really do some good. Danielle Murray, I just want to wish you're going to do great in college. You're going to continue to be a leader, and you'll continue to be in touch with New York City Teens Connection, right?
Yes, I would.
Great, thank you so much. So we want to thank all our guests. Estelle Raboni from the New York City Department of Health and Mental Hygiene, thank you so much. And Dr. Yzette Lanier from NYU, thank you so much. And folks, thank you. Please, if you have any questions about it, you can send us an email at BronxTalk@bronxnet.org, and we'll pass it along. And very, very important issues. Let's really try to work with young people and address all of their needs. I think that's the bottom line here. So we'll see you next week. Good night.